Hip replacement surgery and knee replacement surgery are two of the most commonly performed operations every year. In cases where patients develop an infection around an artificial hip or an artificial knee, a lot of times these cases have disastrous consequences.
I had 2 knee replacements in 2011, and both times they got infected. I talked to the internist and said, what happens if I don't do any more surgeries? Because I was miserably sick of having my leg sliced open and having to go through the rehab and the pain and everything. And the internist says, well, you'll die.
He had undergone a knee replacement for a worn out joint. He subsequently developed an infection of his artificial knee. When I went back to replace his knee, the defect was so large that I ended up having to reconstruct him with a design knee replacement that I typically will use for the cancer patients. Because he had already had a previous 2-stage exchange, he had a relatively large defect to reconstruct. So he required reconstruction of a relatively large segment of his femur bone. I had to remove approximately 4 inches of his femur bone because it was completely eaten away by the infection.
It's 100% better than it was 2 years ago. In all, he probably saved my leg, and he could have saved my life too.
The good news is that there's no sign of any infection coming back. He's still having some pain and some episodes of swelling, but he's better now than he had been for several years.
I'm able to do most everything I could do before, and when I pitched the pain pills, everything changed too. It makes you feel a whole lot better. Everybody says, well, bedside manner, it doesn't count. You've got to be a good surgeon. Well, he's a good surgeon. He's an excellent surgeon, and he's also a good communicator. So there's no surprises, when you wake up from the surgery. You know what you were up against, and you know what you had to look forward to.